Good day, everyone. Welcome to today's lecture on bronchoscopy preparation in the operating room. My name is Athena Opolencia and I am an operating room nurse. It is a pleasure to have you all here as we delve into the critical aspects of preparing for bronchoscopy procedures. From patient preparation to equipment management, from infection control to patient advocacy. Our nurses are integral to every stage of the bronchoscopy procedures. Our goal today is to enhance our knowledge and skills through a mixed method of teaching strategies by traditional visual aids through PowerPoint slides and simulations. This enables us to provide the highest standard of care to our patients in their healing journey. Let us now define our objectives. After successful completion of this course, the learner will be able to prepare all the equipments needed to perform routine bronchoscopy, identify the equipment and accessories used in bronchoscopy and its functions, support the surgical team by anticipating the needs by providing instruments and supplies promptly, set up and check the necessary equipment including bronchoscopes, light sources, and suction devices. Demonstrate proficiency and caring for the bronchoscope after the procedure. Bronchoscopy is a vital diagnostic and therapeutic tool used to examine the airways and address a variety of pulmonary issues. As OR nurses, our role in the preparation and support during this procedure is essential to patient safety, procedural efficiency, and optimal outcomes. These are the equipment needed for bronchoscopy: the bronchoscope tower, the flexible bronchoscopy, and a rigid metal bronchoscope. But for today's video, let us focus first on the handling of flexible bronchoscopes. The parts of flexible bronchoscopes are suction valve, finger-activated suction valve, biopsy port, the lever, the rubber band, and the lens. Don't forget also your light source connection with two rods. Always remember the guide, the circle to circle. Let us identify first the indications of bronchoscopy. This is to diagnose tumors or cancers, assess airway blockage, check narrow areas in airways, or diagnose persistent cough. Your doctor may perform a bronchoscopy to look for and diagnose problems inside your lungs. Your nose and mouth are points of entry for air to move in and out of your lungs through your trachea or windpipe and bronchial tubes. With each breath, your lungs inhale oxygen and exhale carbon dioxide. This exchange of gases is the way your body gets oxygen into your blood. A bronchoscopy may be done to look for and possibly retrieve a foreign object that may have been inhaled instead of swallowed, or to investigate a persistent cough or a cough producing blood. It is also used to obtain a mucous tissue or liquid sample from inside your lungs or evaluate an abnormal chest x ray or CT scan. Before your procedure, or you will receive a medication to help you relax and minimize coughing. An intravenous line will be inserted for additional medications, and your heart and blood pressure will be monitored. You will be given an extra oxygen during the procedure. You will be given either a local anesthetics to numb your throat or general anesthesia. During the procedure, your doctor will slowly thread a bronchoscope through your nose or mouth, down your throat, past your vocal cords, through your trachea, into your bronchial tubes. He or she will examine the lining of your airways and may take samples for laboratory examination or to remove a foreign object. After the procedure, you will be taken to a recovery area. If a biopsy has been taken, you will be likely to have a chest x ray before you leave the hospital. Your doctor will send any mucus liquid or biopsy samples removed from your lungs to a laboratory for examination, and the results will be available within a week. Good afternoon. Today, I'm going to present to you about the bronchoscopy module and equipment preparation for routine bronchoscopy. Here, we will tackle the most commonly needed supplies to prepare ahead of time, the basic components of bronchoscope and how it works. Kindly note that the specific equipment types or brands will differ from institution to institution, but the setup that I'm going to present to you will be not much difference from what others are doing from their institution. Before performing bronchoscopy in the OR, be sure to plan ahead and ensure you will have the appropriate size of the flexible bronchoscope, then gather your equipment and supplies you'll need for the procedure. For the setup, make sure that in the room, everything has been arranged and you check the equipment for functionality and you check the consumables and accessories are available for the procedure. But first, let us check our bronchoscope tower. This is how the bronchoscope tower would look like. I now already plug on to the electrical socket. First you need to do is to open the lamp tower and make sure to open also the bronchoscope connector. There you go. You are seeing that the monitor is working, the lamps are on. We are now ready to check our flexible bronchoscope for the functionality. First, make sure it is on and your monitor is working. Then, using this guide, insert the connector rod to the light source. And activate the lamp. There you go. You are now ready to assist the flexible bronchoscopy. What is the role of the registered nurse in the OR assisting bronchoscopy? First, check and identify the patient with two identifiers and confirm the consent. Position the client, place the patient in a sitting or supine position, and provide supplemental oxygen as ordered. Provide assistance with a diagnostic procedure and/or treatment. Assist with tissue specimen collection for testing. Other procedures may be performed as needed, such as removal of foreign body, bronchoalveolar lavage, placement of a bronchial stent, and aspiration of retained secretions. Secure the specimen and send the properly labeled specimen to the laboratory immediately.
During the procedure, your doctor will slowly thread a bronchoscope through your nose or mouth, down your throat, past your vocal cords, through your trachea, and into your bronchial tubes. He or she will carefully examine the lining of your airways and may take samples for laboratory examination or remove a foreign object.
Post-procedure, be sure to disconnect all the tubings attached to your flexible bronchoscope. Your suction, your biopsy valve, and your suction valve. And disconnect from the light source. Post-procedure. Once the bronchoscopy procedure is complete, disconnect all the components of the bronchoscope system carefully. Disconnect the bronchoscope from any external equipment carefully. Inspect the bronchoscope for any visible signs of damage or contamination. Remove any disposable parts of the bronchoscope, such as suction catheters or biopsy forceps, and discard them according to hospital protocols for medical waste disposal. Rinse the bronchoscope with sterile water or a disinfectant solution to remove any debris or secretions. Our practice here is to hand over to the CSSD technician for proper cleaning and disinfection after flushing the sterile water in the body of bronchoscope. I hope that you have learned something today, and I'm glad to present to you my skills and knowledge about bronchoscopy preparation.